Hi, and welcome to 10 Kids, 2 Docs, Parenting Insights from Pediatrician Moms. I'm Dr. Sylvia Bank.
And I'm Dr. Vivian Carlin. Welcome back. Thank you for joining us today for this special episode. Today is the second part of a 3-part series we have released on autism. What is autism? How is it diagnosed? What are signs that would cause a parent or doctor to consider autism in a child? How can it be treated? Well, today we are going to focus on the parent perspective of caring for a child with autism. And we are joined again by our special guest, Dr. Julia Jackson. If you've listened to our other episode in this series, you know she is a doctor who specializes in child and adolescent psychiatry. She has cared for thousands of children with autism over the course of her 24-year career, and she is the mother of 5 boys, one of whom has autism. She gives us this incredible insight throughout this series from both her extensive clinical practice and that invaluable insight that comes from parenting a child with autism. So I know you will enjoy today's discussion as we hear her story. Let's jump in.
Welcome to the 10 Kids, 2 Docs podcast. Seasoned pediatricians and longtime friends, Sylvia Bank and Vivian Carlin have counseled thousands of parents and are raising 4 and 6 kids, respectively. Join these doctor moms as they incorporate fun and their combined wisdom and experience to share parenting insights for anyone looking for practical and trustworthy guidance. Please note that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment from your doctor.
If I may, and if you feel comfortable, maybe you can give our listeners a little preview on how it presented for you as a parent and like an individual story of what it looked like in your home.
Yeah, absolutely. And this will be a good example too about how parents, are not objective and you have a lot of assumptions. And so we were living in Germany for a couple of years, and our son was in kindergarten and first grade, and he had, periodic behavior issues at school that we'd hear about, but more silly boy stuff, nothing ongoing. When we moved back to the States, he started second grade. And that was the first year that there were just a lot of reports from school about, just not liking school, things like breaking pencils, ripping up his paper, being disruptive, saying no, not being compliant. And just when he didn't do those kind of behaviors at home, but he certainly complained about school a lot. I mean, to the extreme. And in my mind, I was thinking it's probably an adjustment reaction. He loved Germany. That's where he knew, the place he knew, and we just moved back. And so that went on for months until it dawned on me that this is where I first picked up on his ADHD. It dawned on me that if someone brought me that same scenario where largely they're doing pretty well at home behaviorally and the significant problems happen at school, and usually with schoolwork, it's like, well, duh, and so that's where that diagnosis came out. And then, he got treated for that and did really well. And it wasn't until, this is another, how complicated it can be to tease things out as a parent, especially. So it was middle school timeframe, COVID happened, and all of our kids were home for several months. But where I noticed another big hurdle with my son, especially, was when it was time to transition back to school. He went, but he wanted to wear all black clothes. He wanted to have a black hoodie, and that had to be the same hoodie. And he always had the hood up, and he didn't talk to anyone. It was just really, isolated. And even at school, we'd kind of hear about that. The teachers want to know if he's okay. And he was okay. He was happy at home and still did all the things he liked to do. And so again, I just assumed it's probably social anxiety, because it's COVID, and, you had to go back, and it seems like social anxiety to me. He's also very intelligent, and he would get bored easily at school. And so what I did was I got him set up with a psychologist to do psychological testing. One, I was curious, what his actual IQ and achievement abilities were, because he was constantly bored with school and not wanting to do it. And then 2, I wanted to use that to try to communicate with the school better about maybe we can, give him more challenges, keep him interested. So, and that's when, the psychologist, let me know about high functioning, he meets criteria for autism. And it was interesting because it took me by surprise, but almost in the same moment, it was so clear. Like, well, it's just like with ADHD. I don't know why we have blinders with our kids, but it's a thing. And so now I can't unsee it. He clearly has it.
Let me ask you, Has the average age at which this high functioning category of autism is diagnosed, has that decreased? Have we gotten better at it, do you feel like?
In my experience, when pediatricians pick it up and developmental pediatricians pick it up in the toddler, under age, let's say under age 4, under age 5,
Yeah.
even, when it's visible at that age, they tend to be more severely affected.
Okay. Yeah.
So our son, for example, he was in the on-base daycares his whole life, and they did ASQs all the time. No problem. I didn't even see any issues. It was subtle. His restricted repetitive behaviors were and are more subtle than his social. They're still there, but his social delay has been much more prominent the older he gets. And that's what I find too, is that sometimes I'll see kids in the clinic that are prepubertal, and they're kind of silly and goofy, but there's not obvious social delays yet. But then as they get toward middle school, high school, and the kids around them and the social expectations skyrocket, that's where you start surrounding yourself with kids that are primarily communicating through sarcasm and eye rolls and figures of speech, and and collective. They're in groups and they're communicating with their nonverbal. The children with autism really don't intuitively know how to navigate that. Mm-hmm. And so that's where I think you start to see what looks like social anxiety or isolation, because they just struggle. But in elementary school, they're doing pretty good. They can make silly noises, like the second graders that are making fart noises and all the kids are laughing, and it works. But that doesn't work anymore once they start getting to middle school, high school. It's not funny anymore to their peers, and they start to struggle.
What I ask is that I hear this sentiment from parents a lot, where there's like this guilt, this feeling of like, how did I miss this? I've even felt this with friends, right? Where I've seen their child grow up and I'm like, I missed it. Like, I did not see this coming. It was not on my radar when your child was 3. And the parent feels this weight of, oh, I missed this. And, we have such a mantra now of, we want to give developmental services as early as possible, right? We know there's this brain neuroplasticity. So let's target it in these younger years. Let's pick up these kids earlier and earlier. And I'm just not sure that's even possible until we come up with some better type of neurochemical, whatever, like diagnosis for us to be able to do this in this early, this infancy toddler stage. There's also this principle here too, that I feel like where any diagnosis in the DSM and psychiatry, there has to be a component of it interfering with, something with your daily life, whether it's school or social or whatever. And if there's just a normalcy in all of that, then, which you're describing there generally is through elementary school, then it doesn't trigger a diagnosis.
Yeah, I think, we as parents put too much guilt on ourselves about everything. And I think we need to really be conscious about, we just need to stop it, because we're kids are individuals. They're complex. When professionals like yourselves and myself are struggling sometimes to figure it out, how in the heck is a parent going to figure it all out? And so I think we just need to get off our own backs. If it's not a problem, it's not a problem. So for instance, with my son, he had some areas where he was having difficulty, and we addressed it, and then we did it again. But for several years, he was pretty happily just kind of doing his thing. And so do I tell myself, oh, I should have caught it earlier so he could have had all these services? No, because there are really no services that would have added to any of that anyway at that time. Yeah. And now that he's at a developmental age where he really needs to start working on, getting more comfortable with social interaction and understanding subtleties of social communication. Now it's becoming more of an issue, but I don't think addressing it when he was 6 would have changed any of that, if that makes sense.
I think that's such an important point. I appreciate you saying that. And I hope that brings some sense of relief to parents out there that are worried that they missed something or messed up. Right? That we do need to give ourselves a break. Like, even to hear that even a professional, you who treated patients every day with autism, did not see signs of this in your home. So,
and kids are incredibly resilient. It is really hard. I mean, it's possible, but it has to be extreme for your parenting itself to negatively impact your kid for the significant portion of their life. It's really difficult. It's doable. You can do it, but it has to be extreme negative parenting for a long time. And so that's one of the things I learned. I thank goodness I had 5 kids, because you're obviously so much more nervous with your first one, your 2, even your third. By the time you get to your 4th and your 5th, you realize that they're fine. How many months did I spend obsessing and worrying about the impacts of daycare on my young children? If I could have seen, they're fine.
Yeah.
So kids are resilient. I think we put too much pressure on ourselves.
So I think we should maybe move on in the second half to talking a little bit about how having a child in your home diagnosed with high functioning autism can affect the house dynamic as well.
So, Dr. Jackson, if you could tell us a little bit about, how parents can set expectations in the home, like tips or tricks of how to manage things in the home, just going forward, like what kind of advice can we offer to parents?
So, good question. Focusing on autism specifically, I think the most important thing to help the entire family do well with it is understanding. It's a lot of education and a lot of understanding on what it is, how it shows up, what's in that individual's control, and what's part of the syndrome that's hardwired who they are. Because especially for the higher functioning ones, like our son, they don't appear obviously disabled to anyone else usually. Mm-hmm. And yet their behaviors and the way that they speak, or their compliance with, basic requests, they almost sort of come across like they're just a brat, or they just don't want to do it. They're just defiant. And that can cause a lot of, if you don't understand it for what it is, it can cause a lot of parent-child conflict, because it creates anxiety. When children are not complying with basic rules, going to bed on time, getting your work done, even helping out with household things, cleaning up after themselves, and you're doing everything you can as a parent to try to get them to, kind of be where they need to be developmentally, it creates parental anxiety. You start to project into the future. If I don't get a hold on this, what are they going to be like in 5 years, 10 years as an adult? Absolutely. And then that drives, it tends to drive conflict, a desire to control the kid, and put more parameters, whether it's you're trying to bribe them, through, I call it bribing, but you're if you do this, you earn that. Or the negatives you can clamp down too much on the negatives in an effort to control. And it ends up, if you go down that path, it ends up being so much family conflict, and even it can even cause divides in parents, because there's a desperation there, and the children with autism tend to be incredibly rigid, like I mentioned earlier. But yeah. even with basic, following parental rules, they don't flex very well, and they tend to not respond too great either to negatives. Negative consequences. And so anyway, so I think that understanding is incredibly helpful when the parents know what sort of behaviors and, moods, or the way they present, the way they talk to you, is because of their neurodevelopmental diagnosis, and what is something that you can realistically use parenting strategies to, shape the behavior. And it just reduces the family conflict and stress level. And even within siblings, if you guys have, multiple kids as well, the one with autism, or our child with autism in our family, for years, his brothers, were kind of like, why doesn't he have to do it? Why, almost like, why is he special? He's so spoiled. He never has to do it, and I have to do it. And they don't understand, at least not back then, that we're doing everything we can. We're in choose your battle mode with them, because if you push too hard, usually, this is again caveats with in general, you can start to see these explosive behaviors, and then parents start to walk on eggshells a little bit of how far do you push to get them to comply, but don't push too hard, or you might end up with a couple holes in your wall. And so there's this delicate, dance of choosing your battles, and if you don't understand what's going on, and usually at that point, professional help can be significantly valuable. It can cause a lot of family conflict for a long period of time. But once everybody understands what's going on, it's like there's a shift in their mindset. The parents feel less anxious. Siblings slowly come around, a little slower than parents in my experience, but they start to see, they start to realize what's going on, and there's more peace, in the home,
Yeah.
and there's more progress because, individuals with autism don't do very well with noise usually. And so family conflict is going to make them worse if it's verbal family conflict, So I think the way I would answer that question, long story short, is understanding what's actually driving the behaviors is probably the most important thing to help families.
Yeah, I can see that setting everybody's expectations. I would imagine grandparents, this is another, there's all kinds of people that come into the home that are going to have difficulty understanding, setting everybody's expectations. Do you have any examples of, as a parent, how you navigate that rigid stance and the child that doesn't respond to negative consequences? Like, what do you do?
Yeah.
Does anything come to mind? That's hard to explain to somebody what you do.
Sure. You have to individualize it to your child. Again, they're so unique. And so what works for one child with autism is going to not work for another. What I can speak to what not to do.
Oh, yes.
So an example would be, what I used to do is get into these prolonged conversations with our son, trying to get him to see why the way I was trying to, get him to understand things, might be a healthier way for him to look at the world, or maybe it'd be better for him, or, and I would do it for way too long, or just prolonged, like I call it pleasant arguing. You're not really yelling at each other, but you're just going back and forth about, it could be anything. In his case, he's very fixated on cats. He loves cats. He has 2 cats, and he wants a 3rd cat. That's been going on for years. We hear about it every day, at least 3 times a day. Hey, can I have another cat? No, you have 2 cats. Why don't you go see them? Then sometimes he'll walk away. Back then, I would get into this big, long diatribe about why that's not a good idea. Why do you want another one? Because I do. Well, what would that add to your life?
Yeah.
Well, this is what it would, and this would be the problem. They're happy with each other. If you add another cat, they might fight. And I would go on for as long as he was willing to go on, which was indefinitely, if we're talking about his area of interest. But at the end of it, he's no further along the decision point than, can I have another cat? And so I would get sort of frustrated. He would get a little more frustrated trying to convince me of why his idea is right. And it was his therapist that basically pointed that out what are your feelings like in the beginning of the discussion to the end? It's usually escalating frustration. Is it changing anything? No. So she asks me, so why are you doing it? It's like, the answer for that. Right. So the answer is stop doing that. And so I did. So now when he says, can I have another cat? I just say, no, you have 2 already. And I leave it at that. And even if he asks again, or he says, well, that's not whatever, that's not cool. I know it's hard. It stops and he leaves, versus, so try not, I would say
it's a good example.
Try not to get caught in the trap of arguing your way to get them to see things differently, because they probably won't.
It echoes something I've heard from parents with older children with higher functioning autism say. It's like a freedom of coming to this understanding that they are not going to connect with their child on that level. I hear parents try to describe that to me, of like having to realize with their child, and it's so unique, they're all different, of I've tried to have these discussions and then I've learned we will not connect this way. So we have to find other ways to connect.
Correct. Which foot stomps the differences. They're different. They force us to be different. Yeah. But I think that there's a lot of benefits to it as well.
Yeah.
So for me, I don't personally know, maybe if we had 1 or 2 kids or something, but we've got a lot, and I don't personally feel like a loss. I feel fascinated by him most of the time. And as long as he's happy and progressing, I'm happy. Where I get stressed is when he starts to backpedal on basic things, like he starts to refuse to go to school again, or he starts to, just, going backwards. And then I get a little more stressed because I don't care that he's on a different trajectory or timeline. I know he's a couple years behind. He has no interest in driving. It's just, he's a couple years behind. That's fine. I don't have an issue with that. He does schoolwork, he's progressing through the school system slower, but he's smart and he really enjoys it when he enjoys it. And so I kind of feel like he teaches us almost like that they tend to be incredibly in the present time. They're very much so in the present. And in a lot of ways, they seem a lot happier than us because they're not preoccupied with what does that person think. All the social stuff, it's very simple in their mind. Now, I'm going to caveat that there are children and adults with autism that very much so are concerned about social and their impact. With our son, that's not really there. It's very logical and very concrete, and he doesn't really even get bothered, if someone doesn't agree with him. He just moves on with his day, and in a lot of ways, they're happier in that scenario. Yeah, they can be very upset if they do care a lot about social relationships. But I think that's a tough scenario when they really want that connection, but they're not able to create it. That can cause a lot of distress.
Yeah. I love that. I feel like that's part of that. Once you've set your expectations for how this is going to look in your home, and then you're starting to try to process more and more the why behind the behavior and the reaction that you're getting, you can start to even see like the beauty in who they are as an individual, yes. Right? And embrace that.
And it helps you let go of control. I think every parent realizes that at some point, every parent realizes they really don't have control. Yes. They do more so when they're little, but at some point, every parent, it's going to dawn on them that I don't have control over what they do. There's no amount of talking or disciplining or anything that's going to change the fact that they're going to do what they're going to do by and large. And I think when you're parenting a kiddo with any special needs, autism stands out as one of them. You learn to let go of parental control much earlier and much easier, and it becomes easier in other areas of your life too. You need to have things be a certain way.
Well, I would like if you have concluding thoughts to make sure that we capture that.
Yeah, I would say in conclusion, if you're struggling chronically with anything with your child, whether it's ongoing conflict, or struggling to get them to do things that, generally come easier to most kids, going to school, getting their work done, helping out around the house, those sort of things. If you're struggling with that and it's chronic and it's not getting better, the most important thing is to have them seen by a professional. Mm-hmm. You can pick the professional that you're most comfortable with, but have them seen, because that will help you be more objective and see things in a different way. And that will help your kiddo because of that. And parenting any kiddo, especially those with autism, ADHD, most children with autism have ADHD as well. Mm-hmm. I think for me, it comes down to the most important thing you can do as a parent is to maintain that relationship with your child. I believe that comes even over their specific behaviors or any sort of parenting approach. Always maintain the relationship. So if you start to get into a spiral where the relationship itself is starting, now there's going to be moments in any parent-child dynamic where you're arguing and fighting over something. But if that's the majority of the time, it's time to try something different, because it's not working. All of our parenting, the whole point of our parenting is to shape behavior in a positive way and shape development. So if it's not working, you have to at some point have a timeout. And if you need a professional to help you find another way, then that'd be a great time to do it, because you don't want to have that chronic relationship breakdown with your children. I think, so for me, that's my take home from parenting, is always maintain the relationship. If it means the kiddo is not going to pass a few classes, or they're going to have to repeat a certain grade, so be it, because continuing to yell and get in arguments is not helping anyway. So at least you can maintain a positive relationship while you figure out the other things. But if what you're doing is not working and it's causing negative interactions, then it's time to try something different. And it's not always intuitive what to try. Like I said, with the cat scenario, our instincts may be off kilter. If I just talk to them long enough, they'll get it. No, they won't. Most kids won't, even typically developing kids. So it's really, I think, kids learn by how we treat them. They learn a lot through mutual respect. They learn a lot through modeling. They tend to do what we do more so than what we say. And that's my take home point is, and be okay with changing the timelines. We have these artificial ideas based on societal norms of what should happen in what time frame. But if that's not where your kid's at, it's okay.
Yeah.
You know, nothing, you're not going to self-implode. You know, you're not going to end up being banished to a faraway island if they don't finish high school on time. So kind of keeping things in perspective is really helpful too, and not getting caught up in your own, anxiety.
Yeah, I also think it's really important for parents. One of our jobs, I see my job, is to accept our child, right? Where maybe society or their groups aren't accepting them, to fully accept them the way they are and modulate our perspective, right? To help them. And maintaining that relationship that you have with them allows us to continue to be a presence, a positive presence in their life, right?
Yeah, absolutely. You might be the only person in their life that is giving them a positive experience. So it's so important to be that person.
Right.
Yeah, I agree. It's hard to do though. If it were easy, we'd be out of a job, right?
Worry, right? To put the parental worry aside and step in the role of acceptance and building relationship with that child, right?
And then, try to look for the beauty in it too. Try to, find their strengths and focus on that too. It's really important that we're not sort of just focusing on the gaps, where they could be or should be in our mind, but look at the gains, look at what they, look at their areas of interest. I mean, even, our son, he's fascinated with cats. That's pretty cool. As a child psychiatrist, you don't always see that. Some kiddos, are their kindness toward anything, humans or animals, is really struggling. So you can find beauty and you can find strengths in any human, for the most part. And I think focusing on that really helps drive that relationship, and it supports them to keep growing and flourishing in the areas that they are meant to do, not what we think they should do.
Right. And it helps with their self-esteem, right? To build them as a human being and feeling positive about themselves, right?
Right. Absolutely. Absolutely. Yeah. And they do, even though there's a social delay, they do connect in their own way. So I'll give another example that comes to mind. I had to go on a work trip recently, and I am very much so his person. So they do connect. They're very, but it's not a verbal way of explaining that. And so what I noticed during the night before I left was a lot of, will you come see the cats with me? You want to come see the cats? You're going to miss the cats, aren't you? You're going to miss them, aren't you? Come see them. And that's his way. I know that's his way of wanting to connect before I leave.
Yes. Yeah.
And, yeah.
It's like his love language.
Yeah. And if you don't see that for what it is, you might, it kind of like would break my heart if I didn't catch it, because you might be so busy that you're like, no, I got to do this. And I'm not going to, not realizing that that's their attempt to connect with you. If you view it as, I can't see the cats, I saw them earlier today, they're fine. So you have to sort of, look for those positives and look for their unique way of communicating and connecting, and try to capitalize on that when you can.
I love that.
Well, this has been a really great discussion. I just thank you so much for your time and bringing to us your personal story, as well as your expertise in treating thousands, if not tens of thousands, of children with autism. So I just can't thank you enough for joining us today.
Yeah, you're very welcome. Thank you for having me. It's been a lot of fun.
It's 10 Kids, 2 Docs. I'm Dr. Sylvia Bank.
I'm Dr. Vivian Carlin.
I'm Dr. Julia Jackson.
We'll see you next time.
See you next time.
Thank you for listening to 10 Kids, 2 Docs, hosted and created by Sylvia Bank and Vivian Carlin. If you enjoyed this episode, please subscribe and recommend our podcast to other listeners. Visit our website at 10kids2docs.com where you can find links to social media and leave comments or suggestions. Back next week with more topics in parenting.